Happy Friday to you. This is the Agent Survival Guide podcast, Friday 5, which normally serves as a weekly recap of industry news for insurance agents, highlighting 5 headlines from the week. This week, however, we are focusing in on the CMS, Medicare Advantage, and Part D final rule for coverage year 2026. We've mentioned a few times that not a lot has changed. In fact, I probably said those exact words in last week's episode. I also mentioned the provisions CMS was not implementing in the final rule, alongside details of the Part D redesign program for 2026. Last week's episode is linked in the notes just in case you missed it. This week, I thought we'd focus instead on what CMS is implementing in the final rule. And thankfully, there are actually 5 things to talk about, so that works out great. Starting out at number 5, clarifying MA organization determinations to enhance enrollee protections in inpatient settings. Or, as CMS puts it in their fact sheet, holding plans to approved inpatient admission decisions and closing MA appeals loopholes. Couple of things with this one. First, CMS is finalizing that their definition of the term organization determination, quote, includes MA plan decisions made concurrent to the enrollee's receipt of services, end quote. That is intended to clear up any confusion over when a plan decision is made. It might be made before, after, or essentially during receipt of services. According to CMS, quote, the goal of this provision is to ensure that if a plan approves an inpatient admission, it will have to honor the prior authorization, end quote. The hope is to cut down on retroactive denials or reduction in benefits, only allowing appeals of, quote, approved admissions for obvious error or fraud, end quote. CMS is also codifying their guidance requiring that anytime a provider, quote, submits a request on behalf of an enrollee, end quote, plans must notify both the enrollee and provider when a coverage decision is made. And then as far as payment is concerned, Medicare Advantage enrollees become liable for payment of services when the MA organization makes their decision on a provider's claim. So the provider files the claim for payment of services with the plan. The Medicare Advantage plan makes their determination, and then the enrollee becomes liable for payment. Moving on to number 4, improving experiences for dually eligible enrollees. New this year for dual-eligible enrollees in applicable integrated plans, or AIPs for short. Enrollees that fall into this category will get what CMS is calling an integrated member ID card, so that they can use the same card for services regardless of whether Medicare or Medicaid is footing the bill. And then more broadly, applying to all D-SNP plans, so for all your dual-eligible clients, CMS finalized some specifics around the timing of health risk assessments, or HRAs. Plans and enrollees will have 90 days to complete those assessments, with the clock starting on the enrollee's effective coverage date. And while we're on the topic of HRAs, implementation of the integrated HRA has been delayed until the 2027 coverage year. So for the time being, enrollees will still have to complete separate health risk assessments, one for Medicare and one for Medicaid, but the integrated version is coming. Number 3, vaccine cost-sharing changes. Super short one here on vaccines. When the Advisory Committee on Immunization Practices recommends a vaccine for adults and it is covered by Part D, it will be provided to Part D beneficiaries with no cost sharing, and the Part D deductible does not apply to it. Number 2, insulin cost sharing changes. Didn't want to lump this one in with vaccines because there's a little more complication to this one. We'll start with the similarity to adult vaccines. For insulin products that are covered by Part D, the Part D deductible does not apply. Cost sharing on a 1-month supply of covered insulin products is set at $35 per month for the remainder of 2025. In 2026 and coverage years beyond, a covered Part D insulin product will cost a Part D enrollee the lesser of either $35, 25% of the maximum fair price, or 25% of the negotiated price. So basically, whatever is the lowest cost out of those three amounts, that's what a Part D beneficiary will pay, again, on insulin products covered by Part D. The $35 amount is static, while the other two could change over time. And now, coming in at number 1, but not necessarily any more or less important, the Medicare prescription payment plan. I won't talk about what CMS did not finalize, because that information applies more to Part D plans and pharmacy providers than agents and their clients. The TLDR on that is that CMS understands that this is a new program. It's going to take time to work out the reporting kinks. So they're allowing more time for information requests, elections, and opt-outs. The important one that your clients need to know this upcoming AEP is that if they are currently enrolled in the Medicare prescription payment plan, they will be automatically re-enrolled in the program for coverage year 2026. If they don't want to participate in coverage year 2026, they'll need to submit an opt-out request. That would be a good process to familiarize yourself with before the start of AEP, just to make sure you know how to handle it if you tell a client about it, and then they would indeed like to opt out. Now, of course, I have to issue my typical disclaimer that these are not the only things mentioned in the final rule. They are just what I picked out to share here today. We will be linking to the press release, the fact sheet, and of course, the final rule in the Federal Register in our episode notes. Always recommend agents take the time to look through those documents and familiarize yourself with all of the changes outlined by CMS. Another action I recommend, if you are listening to the show right now and you are not following along with us, please follow along with our show. Super easy to do that. You can listen on all the major podcast directories, including the one you are listening on right now. It is a great way to stay updated on what's going on with CMS, the industry as a whole, interviews, and so much more. All you have to do is hit that follow button, and we will be so grateful for you doing that. That is all we've got for this week's episode. I hope you have a great weekend. Stay healthy and stay safe out there, and we will see you next week. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. This episode was written and produced by me, Sarah Ruppel. Script editing and fact check by Tina Lamoureux. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen.